look at the real risks? Can we work together to reduce those risks to a minimum that's acceptable? Can we have in place a means then to manage something if it does happen? And then can we do that on a no-fault basis? Can we do that on the basis that we've all agreed that this is the best thing to do? Because you're never going to reach a point where there's absolute scientific evidence that it's safe to bring 10 people together, or 20, or 30, or 40, or 60, or 200, or 2,000, or 20,000, or 200,000. What we know is large numbers of people gathered together in close quarters in the presence of the virus will result in amplification of the disease. Best evidence would suggest that the physical distancing of people is very effective in reducing the risk of that spread. Where you then compress that distance to almost nothing, then you have to accept that the risk increases. Because if the basis of risk reduction is to physically distance people, then pushing people back into very close contact by extension says the risk will increase. But at the same time, people want to get back to normal life. So I think this is going to be, it needs to be a carefully discussed process. It will be driven by science, but it also has to have an element of practicality about it as well. I'm sorry to not be as precise as you may want me to be, but these are considerations that really have to be considered at a societal level, and it has to be based, yes, on evidence, but it also has to have a practical consideration as to how do you adapt science and evidence to the reality of living lives.
Thank you very much. We will now go to Argentina. We have Valeria from Radio CNN Argentina. Valeria, can you hear us?
Oh, hello. Are you listening to me?
Yes, please go ahead.
Hello. I would like to know what do you think about the evolution of the pandemic in South America? Thank you.
So thank you for the question around the evolution of the pandemic in South America. So what we are seeing is, I have to look at all of my numbers, is that there's increasing trends in terms of case numbers in a number of countries in Central and South America. And of course, this is a worry, because what we are seeing is that once the virus has an opportunity to take hold and to really transmit between people, if measures are not in place, then it can take off very, very quickly. And you can see doubling times of 3 to 4 days, which is incredibly rapid. And so what we need to see happen in South America, and what we are seeing that is happening in South America, is that all of these measures we've been talking about, so getting these laboratories to be able to identify cases, making sure that the surveillance systems are in place and the workforce is in place to be able to detect those cases. We've seen in a number of countries that public health measures and social measures have been put in place with some stay-at-home orders, and that is buying some time. But again, as I said earlier, it's important that we use that time wisely. There is very strong commitment by governments to have an all-of-society, all-of-population approach to engage populations, to bring them along, to be able to inform them and to seek input back. And that's really important. We're seeing the trajectory of this pandemic, the trajectory of this outbreak in every country depends on how each country reacts. And that is consistent across all countries, regardless of high income, low income countries. And so we are seeing an increasing trend in case numbers, but there still is opportunity. The window of opportunity, as Dr. Tedros has said, still remains in many countries to be able to suppress that transmission and to ensure that we don't have massive outbreaks in some countries.
Thank you very much, Dr. Van Kerkhove. Next question, we have Priti Patniak from the New Humanitarian. Priti, can you hear us?
Yes. Can you hear me?
Yes, please go ahead.
Yes, my question was for Dr. Tedros or Dr. Ryan. I wanted to find out, all the considerations that organizations like WHO and its partners take with respect to diverting funding or putting on hold activities that are meant for addressing other infectious diseases and having to take a call vis-a-vis their fight against COVID. What are some of the considerations, if you could speak about it briefly?
Hi, Priti. I think all countries face this same issue. A major emergency, number one, it diverts attention, it diverts time, and it can divert resources as well as you focus on what is most urgent and most dangerous. But the Director General may speak on this, but there are essential health services that are in place, core immunisation services, services to refugees and to displaced populations, TB, HIV services. As Maria says so many times, women are still giving birth all over the world and need safe antenatal and delivery services. So this is something that needs to be preserved, these core essential health services, and it's really important that countries try to do that. We have a whole team here and across the world that is dealing with sustaining essential health services, led by Ed Kelly and with regional counterparts, and we take that very seriously. The UN has been working very diligently over the last number of weeks under the leadership of Robert Piper in New York, looking at this across the system in sustaining essential services across all of society, with health services at the centre. And I believe there will be a major release of information and publication on that over the weekend or early next week. But we've been working very much with them on that. Certainly in our area of emergencies, the conflict in Syria, the conflict in Iraq, the conflict in Yemen still exist. The fragilities in Somalia, in South Sudan, in the Sahel still exist. And our teams on the ground continue to work with governments on them. They haven't gone away, and they won't go away, unfortunately. And therefore we continue to be focused on dealing with COVID-19 as well as doing the other things that we do. And we have major programs in all of these areas. The other concerns will be that we have a major yellow fever threat in parts of East Africa that must be managed. We obviously have always the threat of cholera and other epidemic-prone diseases. As you've seen, we've had the resurgence of Ebola in DR Congo. So we need to keep an eye, and we have one of the things we've done here in Geneva. We have a completely separated team who are doing nothing else but managing epidemic intelligence, verification and response for other epidemic-prone diseases and emergencies, and we've isolated that team to only work on that so that we don't miss things. And equally the same on the humanitarian front. And Dr. Ibrahima Sosef Fall, our Assistant Director General on the emergency response, is dedicating almost all of his time to leading on the humanitarian front and co-chairs the IASC Committee on COVID-19 and sustaining humanitarian response with Mark Lowcock. So we've done our best to try and preserve our services and our support to countries across all of these areas. But I have to admit that is not easy in the context of the resource constraints we face in continuing those programs.
Thank you very much, Dr. Ryan. Now we go to Jerry from Guyana Catholic Standard. Jerry, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, please go ahead.
Hi, good morning. My question is, there's a lot going on in my country especially, and around the world. People are not really aware and serious about this stuff because, as you know, religious gatherings are going on. And secondly, some protest against lockdown. Is it the responsibility of the individual countries, or WHO can have some serious sanctions against some countries who are not following the rules? Thank you.
We may wish to speak to this. we have no, we're a secretariat of 194 member states. We have no legal authority over any sovereign nation on this planet whatsoever. Under the IHR, we have certain powers that are allowed to us by the member states to seek verification of outbreaks, to publish information regarding those events. We have no right to enter countries without permission or without discussion, and we have no rights of enforcement of any kind when it comes to health implementation. However, we have science, evidence, and the normative role we play, the mandate we have to establish global standards and to give strong advice to countries regarding what are rational public health measures. What we can do is lay out what we believe to be the rational strategies to respond to disease. As we did in January in the case of COVID, we talked about comprehensive strategies, we talked about case finding, we talked about testing, we talked about contact tracing, we talked about community empowerment, we talked about implementing both containment and mitigation strategies at the same time. We spoke about what was needed to suppress and control this disease. We spoke to that again and again and again. And in doing that, many countries picked up and implemented those kinds of measures. When it comes to what one individual country does, they will see our advice, they may see what other countries around are doing, and they may look internally, very often, and correctly so, to their own public health and scientific communities and ask for advice as to the best way forward. And you'll see that many of the countries that have responded very well to this have relied heavily and worked very closely with their scientific and public health communities and worked hand in hand, politicians working hand in hand, listening to and implementing science-based policy. And in that sense, where we see situations where governments may be straying very far away from that sort of an approach, we engage with them, absolutely. We don't engage in public debate. We don't engage in trial by media. We engage as we do, as a trusted partner. And we engage with those countries strongly and robustly if we feel that their public health strategies are ineffective or not been implemented properly. And we do that time and time again. We also engage when we believe they are. I've just spoken about South Africa and what they're doing. We've spoken about other countries here. We've spoken about Singapore. We've spoken about South Korea and many other countries that have implemented very rational policies. So I think the power that we have is the power to persuade, and persuade through science, persuade through evidence, persuade by demonstrating what other countries are doing and showcasing good examples of good practice. Beyond that, WHO has no power to enforce, no power to put any form of pressure on a country to change what is their sovereign will.
We have staff we have thousands of staff, and we have WHO staff in 150 countries. And those staff are working directly with Ministry of Health officials, scientists, public health professionals to persuade, as Mike has said, to advise on what needs to be done and to sit across the table, to sit together, to train, to work hand in hand with our counterparts in countries to help them get through this, to help them plan, to ready their systems, to implement those systems. And you mentioned Guyana. I'm looking at your case numbers. The case numbers there are very low. I see 65 total cases so far and seven deaths. Every case is a tragedy, but you have in your power what can be done to contain this. And so what we do is with our staff is we help, we support, we empower, but it is up to everyone in countries to be able to implement these plans, to ready their systems, and to actually activate them. And what we have seen in countries, what we are working on for national strategies is to reinforce the action plans that are developed, to help ministries of health coordinate across different sectors so that there can be an all-of-society approach, to provide recommendations and trainings to engage communities, empower them, so that everyone in the community is part of this fight along with government officials. To have the systems in place to find and test and isolate and care for every case, to ensure that we trace and quarantine every contact. When we say that, that means individuals. That means a dedicated workforce to be able to carry out all of those actions.